Hi everyone, this is Bernice Galvez Soto with the Quality Assurance and Compliance team. Today I want to welcome everybody to today's Right Way Wednesday video and to actually welcome you to talk to you guys about a very important subject, which is communication. I'm going to be focusing on communication between the therapy team. The therapy team includes physical therapists, occupational therapists, speech therapists, and assistants based on discipline. The reason why I want to focus on communication is because communication can actually come in different formats. Communication can be verbal and nonverbal. However, just like many of us who have diverse expertise in different areas of the therapy field, communication is actually something that we need to build, and that we also need to become experts in order to assure that we're providing effectively between the team. I think that you all, just like myself, agree that we have one ultimate mission every time we arrive to a clinic, which is to provide the best quality of care for the best physical and well-being of our patients. So with that being said, I want to move forward into how is communication affected when there is barriers, and then when is communication more effective when there are no barriers. So if we start looking a little bit at the barriers, some of the barriers tend to be individuals who struggle to communicate in person and verbally. Those individuals can be very independent and can actually struggle to have trust in others. And many times they don't do it intentionally, but they do not realize that they're not socializing, that they're not getting involved with meetings and so on. Now, the barrier or the negative effects of those type of reactions is that it decreases the level of trust, loyalty, responsibility, and teamwork overall. Now, if we were to build different types of habits and assist these individuals within our team, we could actually think of the opposite effects. The opposite effects is having a team that is strong, that supports each other, that knows how to have everybody's back, and has a mission. A mission, again, to improve the best quality, not to improve, but to provide the best quality of care out there. So research has shown many times that healthcare professionals that struggle with communication have a struggle being part of teams. And that's why I initially started by saying, we need to start looking at how communication verbally and non-verbally can be effective to assist every team out there, to assist every discipline. At this moment, we're going through a significant transition of many changes in healthcare. And even with these changes, our time is being limited as we're getting more and more training that sometimes we don't even know how to function. One day we are told implement this, the next day we're told do this, and so on. Then we're like going back and forth and saying, okay, Bernice, what do I do? But here is one thing that I could say. We need to start opening our lines of communication, regardless whether it's just with our therapy team or outside our therapy team. We need to be secure. We need to know what type of communication to use. Many times it is just going to a stand-up meeting, a care plan meeting, hearing out what's going on, communicating what is taking effect in a therapy level, and bringing it back to the team. Maybe even if it's one patient scenario, that patient scenario, whether there is positive or negative or in general constructive feedback, bringing that feedback to the team and saying, guys, I have a concern about this, or, we should start thinking about other ways to do this or that. It's going to open up ideas. It's going to open up the lines of communication. We might actually start hearing from some of our colleagues ideas that we never thought, or things that we forgot that we are actually able to do, or things that we forgot that we need more tools to actually apply them to the care that we provide daily. If care plans are not an option, what about stand-up? What are you hearing from your partners? What are their needs? Are those needs related to therapy, or can therapy help with those needs? Again, this goes along for management and non-management healthcare providers. We all need to start listening in and bringing that communication back to the team. resources. Here with HealthPRO-Heritage, all of our associates know that there are available resources that can be printed because they're either created bi-monthly. These includes our Wednesday Wire articles. On the other hand, we also have different blogs, videos here on our documentation success page that can actually be shared with our teams and say like, hey, I heard about this great resource on ICD-10, or I heard this great resource on Daily Notes. I saw it on the documentation page. Check it out. Are we communicating with our teams what is out there? And then one of the non-verbal formats of communication that it's always available is documentation. Yes, I know that this is an area that is constantly brought up, but we need to start actually using documentation as a non-verbal form of communication between colleagues and teams. Why? Many times we're not available all the time there to actually assist with the question that just popped, or with little concerns that actually are brought up to the table. Either we are on PTO, we are in another facility helping out, or whatever the case is. Many times unexpected situations do happen, and if your immediate supervisor cannot get a hold of you, or your colleagues cannot get a hold of you, as a team, you guys should feel confident to say like, you know what, ma'am, or you know what, sir, give me 1 second. I'm gonna take a quick review and documentation and get back to you with some answers to your questions. Your documentation should be clear. Your documentation should be skill. Your documentation should be detailed. Detail enough that any clinician in the team, whether it's a PT, a CODA, a speech therapist, whoever it is, they're able to give the proper information back to the parties that are requesting it. Everybody should be able to follow through documentation and say like, I know exactly what their goals are. I know exactly what their mission is. So here is information that I have for you. So again, as a team, start exploring. We all have different skills. Like I said, as clinicians and therapy, as healthcare providers for therapy, we all have expanded and branched out in different areas. Some of us have focused on neuromuscular issues. Other ones have focused on musculoskeletal issues, whatever the case is. And that is awesome. It's always skills that I want to say, you know, guys, use them. Kudos to you guys for taking that extended time, but do not forget on essential habits such as communication. And if you are already a good communicator, that you know you can actually help others, bring those ideas to the table. Say, you know, I understand that you don't like going to meetings. What if I go to the meetings, but then you take over this part where you communicate it to our own team here, and you don't have to actually integrate with the facility team? What if one of you guys say like, okay, this week I'm gonna print out the article that is provided by the company, and your job will be to review it and to communicate what you learned on that article with the entire team. Everything again is communicating all the changes, communicating everything that is taking place right now to assure that, again, you're providing the best quality of care to all the clients that you are serving. So again, I want to thank you today for watching this Right Way Wednesday video. If you have any questions, feel free to actually put them in the box below. Otherwise, we'll see you next time on our next Wednesday, Right Way Wednesday video. Take care.